If you're trying to conceive or you're already pregnant, there's one small but mighty vitamin you simply cannot ignore: folic acid. It could mean the difference between a healthy pregnancy and devastating birth defects. Folic acid, also known as vitamin B9, is a powerhouse nutrient that plays a vital role in the earliest days of your baby's development. Yet so many women still aren't getting enough of it. Today on HMedics, we'll break down exactly why folic acid matters, how much you need, and how to make sure you and your baby stay protected. What is folic acid? Folic acid is the synthetic form of folate, a B vitamin naturally found in foods like leafy greens, beans, and citrus fruits. Your body uses folate and folic acid to make new cells, everything from brain cells to blood cells to the precious genetic material that carries your baby's blueprint, DNA and RNA. Why it's crucial in pregnancy. During pregnancy, your need for folic acid skyrockets. Why? Because your baby's brain and spinal cord, known together as the neural tube, begin forming just days after conception, often before you even realize you're pregnant. The neural tube starts out as a tiny ribbon of tissue, which closes to form the foundation for your baby's spine and brain within the first month. If there isn't enough folic acid, that tube might not close correctly, leading to serious birth defects. Neural tube defects explained. One of these conditions is Spina Bifida, where the lower part of the spinal cord stays exposed. Children with Spina Bifida often face lifelong challenges, including surgery, mobility problems, and nervous system issues. Another, called anencephaly, happens when the upper part of the neural tube doesn't close, stopping major parts of the brain and skull from developing. Sadly, babies with anencephaly usually cannot survive beyond birth. Other possible benefits. Folic acid may also help prevent other birth defects, such as cleft lip, cleft palate, or certain heart conditions like atrial septal defect, which is a hole between the heart's upper chambers. How much folic acid do you need? Because the neural tube forms so early, experts recommend all women of childbearing age take at least 400 micrograms of folic acid daily, even before trying to get pregnant. Once you're expecting, that amount usually increases to 600 micrograms per day. In some cases, doctors may prescribe higher doses like 1,000 micrograms, especially if you have a history of miscarriage or certain genetic conditions affecting how your body processes folic acid. Best ways to get folic acid. While you can get folate naturally from foods, your body absorbs synthetic folic acid more reliably. That's why a daily prenatal vitamin is essential, even alongside a balanced diet. Remember, prevention starts before you even know you're expecting. When to talk to your doctor. Every woman is different. Always discuss your ideal dose with a qualified healthcare provider, especially if you have past pregnancy losses or underlying health issues. Your caregiver can help you find the right plan to protect you and your baby. Pregnancy is one of the most incredible journeys your body can take, and folic acid is a small step with a huge impact. If this video helped you, please consider giving it a like, subscribe to HMedics, and share it with anyone planning to grow their family. And tell us in the comments, did you know about the power of folic acid before watching? We'd love to hear your thoughts.